Hello. You'll have an opportunity today to join me on a tour of Topeka. This tour really looks at health equity in Topeka. We thank the Kansas Health Foundation and the Topeka Community Foundation for creating time to really explore how patterns were created that segregate communities, to look at the question of how do we transform communities and break those red lines that were created many years ago. So thank you in advance for joining me in looking at health equity. Think about your community and how you make change, and learn a little bit about Topeka, Kansas. Through collective impact and your support, we can continue to see change in the future. Thank you.
Segregation existed, and the red line maps are a physical manifestation of how that happened in Topeka and when it happened in Topeka, and that we're still living with some of the lingering legacy of those maps. Presenting the historical point of view combined with the current efforts to change things in Topeka that have been historically segregated was amazing to see some of the energy and effort that's going behind that.
We should care about it because of our community, our students. We need to know where they're coming from. You know, we all play a role if we live in the city of Topeka in ensuring that this next generation of kids grows and works here in Topeka and is successful wherever they go. My hope is that we use this data to make a change. We can target certain areas of Topeka now that we have that data. We know that we can interrupt some of these cycles of poverty. And I think we can use some of that data to inform and strategically target some of those areas of our schools.
You know, you think about wanting what's best for your community, and you think about programs, and this has really broadened that view to systems and policies that have been put in place long before I lived in Topeka, began my career here, educated my children here. But those kinds of things are what will need to change in order to make this the community that we all want it to be.
Hearing about what it looks like in Topeka is new. I mean, we've been really focused on Wichita and Wyandotte County just because those are some of the areas with some of the greatest health disparities, but we know redlining had a huge impact on Topeka as well. So it's been really great to just hear a little bit of the nuances of what it's done here in Topeka. There's so many similarities of what we see here in Topeka in terms of the impact of redlining on this community. Same thing we see in Wichita and in Wyandotte County. We know that redlining and the historical practice of redlining has had a huge impact on the health and well-being really of communities that were redlined.
So, you know, the point, of course, was to learn a little bit more about the historic practice of redlining, what it has meant in Topeka specifically, to see some of these areas in the community that, you know, fell within the red lines that were literally drawn on maps. And then, of course, to learn the after effects. We're 100 years, you know, almost, after the first redlined map was drawn, to sit back and measure progress now. It's really, you know, illustrative and instructive for grant-making organizations like the Kansas Health Foundation, who are striving to improve the health of all Kansans.